Hi, I'm Saj Rambab, one of the respiratory therapists at Morlen Health.
And I'm Ed Birnbaum, also a respiratory therapist with Morlen Health Pulmonary Rehabilitation Program, home-based pulmonary rehab.
Welcome to Breathe Better 101, Managing Stress and Depression, part of the Pulmonary Rehab Educational Series. Managing stress and depression. This is a fairly heavy topic, but please remember that at the end of this, we'll talk about how to get help and how to seek help if you need help. Please take note of it and take notes if you need it. So chronic lung disease affects your emotions. And how it does that is you can't do all the things you used to do. So you can't do the things you used to do when you were younger. Must do things much slower than you're used to. You often feel tired. You have a hard time sleeping, feel ashamed or blaming yourself for having chronic lung disease, especially if you're a previous smoker or even a current smoker. Feeling isolated from others because it's hard to get out and to do things. Your activity is limited. And breathing problems can be stressful and scary.
Right.
And your emotions can affect your chronic lung disease. So with depression, it can cause more chronic lung disease flare-ups, or as we call it in the business, exacerbations. It also zaps your energy and motivation, and it makes it harder to eat well and exercise, take your medications as directed, follow your treatment plan, and get the right amount of rest. You don't want to get too little, and you don't want to get too much. And stress and anxiety are known chronic disease lung triggers, so they can cause exacerbations, flare-ups. You may breathe faster when you, which can make you more short of breath, and we'll go into the dyspnea cycle in a little bit. And when it feels hard to breathe, you feel more anxious. And when you feel more anxious, you get shorter of breath, and you get stuck in what's called the dyspnea cycle.
That's right.
Now, the dyspnea cycle in this diagram, here's sort of what happens. So you get short of breath, and you can start at any point in this diagram. So you'll say you get short of breath, then your anxiety increases, then you panic, and then you get more short of breath, and then you get increased anxiety, panic, and it's a spiral, and we call it like a downward spiral. So once you've had this, it can be very scary, and it makes you nervous to get out and do things. So it causes people to limit their activities to not feel short of breath because they don't want this to happen again. And this ends up taking the joy out of life. So because you're so afraid of getting in this dyspnea or shortness of breath cycle, you don't want to do the activities that bring you joy or that make you happy or that you want to do. And then being sedentary can lead to other problems such as obesity and heart disease.
So it's one of those downward cycles where one thing leads to another, and each of them makes everything worse. Having chronic lung disease affects you emotionally. What happens to you emotionally affects your chronic lung disease. Each makes the other worse. But we're going to talk about how to break that cycle and even turn it around.
So breaking the dyspnea cycle, you want to take control and use pursed lip breathing. Now, as you can see on the slides, the diagram, the gentleman's taking a count of 2, inhale through his nose, and a count of 4, exhaling out of his mouth, like he's trying to blow a feather across the table or blow a candle out. So you're really going to want to focus on taking a breath in through your nose or mouth if your nose is congested or blocked up. And you want to take a slow, deep breath in, but then your exhalation should be longer than your inspiration. So your breathing in should be nice and smooth at a certain number. You can count it off. And then when you exhale, when you breathe out, you should count it off, and it should be hopefully twice as long as what you did when you took in. So you want to really smoothly and calmly empty your lungs out as much as you can. And what that does is it helps stent your airway open, and it causes laminar flow in your lungs. So the air goes smooth and deep into your lungs, and thereby pushing the old stale air out of your lungs, so you have better gas exchange and more efficient gas exchange.
Right. When you do it correctly, it feels better. So don't, you don't want to worry about, did I breathe in for the right number of seconds and breathe out for, practice it, and when it will help, and when it's helping, you're doing it correctly.
Exactly. And one of the things that we say about pursed lip breathing is it can be a little bit counterintuitive. When you're younger and you get short of breath, you usually hunch over and you take gasping air. But it's gonna not gonna be a problem because you're young, you're healthy, you have good lungs, good heart, and so you can recover quickly. When you're older or you're deconditioned, it is better for you to breathe this way. So instead of gasping, take slower, deeper breaths in a more controlled way. So it seems counterintuitive, but once you've tried it and done it, you understand the benefit of it. And it's a huge benefit.
Mhm.
Also, pacing yourself. So if you know you have to go out and do something or be in the house and do something, make sure you have enough time and pace yourself. Slow and easy wins the race. Exercise, it helps you to handle more activity with less shortness of breath. And then go to your safe place mentally. If you're having a bad day, just try to think about whatever your safe spot is or whatever the places you love to go to most. So, some other ways to manage stress and avoid depression is identify people, places, and situations that can cause you stress. So, I think it's safe to say that most of us have had people in our lives that are stressful, that can cause us more stress. So if you're in a bad place, if you're already stressed and you're depressed, try not to spend too much time with them because they can also bring you down. They don't do it intentionally, but it just sometimes it happens. So try to pick um, the people that you're going to interact with according to what your mood is, so you don't have both of you in a bad place, or one of your friends pushes you into a bad place because of their behaviors or their activities or their actions, because for sure your friend would not want to do that to you, but also you have to take a little bit of ownership in that and take responsibility for your overall health and avoid people um, that can put you in a bad situation, and try to avoid things that make you too anxious. Try to go shopping during quieter times if lots of crowds and shopping makes you anxious. Traffic makes people anxious. It makes me anxious. So avoid high traffic times. Unfortunately, some people might live in areas where it's always bad traffic. So just one of those things. But maybe take an alternate route or plan to travel at different times if possible, so it's less traffic. Um, but try to figure out what things can make you anxious and try to avoid them, or eliminate them, or go at times, or to other places where it's not going to be as overwhelming. Practice relaxation exercises. When we just talked about the pursed lip breathing, it can be meditating, could be praying, could be looking out a window. Don't take too much on. So learn when to say no. So if you want to do a couple of activities, that's fine. We recommend do one activity before lunch or one task before lunch and one activity after lunch. Try to keep it short, something easily to accomplish. So you can get that. You can just tick that off your list. As you do pulmonary rehab and you get stronger and you're able to do more activities, you can maybe add one on, and then go more and add more on when you get stronger and you recover quicker. And then stay involved. So attend social events, go to a pulmonary rehab class, go to a Better Breathers Club, go to a church event, make some time for friends that are uplifting to you, that you find a lot of joy from. Church events, I think I already mentioned. So just find something else that can get you involved and have you some nice positive human interaction. Now, the physical response to stress is both good, which is eustress, so that's a good type of stress, and then bad stress. Well, we'll talk mostly about the bad stress. I mean, technically, the fight or flight, which is supposed to be a good stressor because it gets you the adrenaline, the muscle tighten, your heart rate and breathing goes up, but it helps you the fight or flight. So that's a protective mechanism that your body does. But it can also be a bad type of stress when you are deconditioned or older or have lung issues, chronic lung diseases, because it can make your COPD or asthma flare up. So you want to try to avoid those type of situations as much as possible because you don't want to get into a dangerous situation in general if it's the fight or flight is kicked in, and then also dangerous situation with a really acute, a quick onset of a COPD or exacerbation of an asthma attack or chronic lung disease deterioration. So you want to try to avoid that as much as possible.
And once this response has been triggered, and we're not always going to be able to avoid it. None of us can. Just being shorter breath and things you do in your life are going to sometimes make you shorter breath. Often, we're giving you some means to get that under control, both emotionally and physically, using pursed lip breathing, slowing down. Pacing yourself reduces the stress, slows that adrenaline pump, relaxes your muscles, and you can actually make them relax by using those techniques. We have a whole video, by the way, just on this, so which goes into more detail than we're able to do in this one. But you can actually get that under control. Not only avoid situations that cause it, but when it is triggered, get it back to normal as quickly as possible, much more quickly, and do better than you would otherwise. I would suggest going to that video on managing shortness of breath. It's on the morlenhealth.com website, so that you can find it, and we hope that it helps.
So also some other tips and tricks to manage stress and avoid depression. Practice positive daily health habits. So get up and get dressed every morning, daily exercise, eat a healthy diet. One thing that I didn't put on here is also like a gratitude journal. Just when you wake up in the morning, write three things. They have 3-minute journals where you can just write three things down that you are happy about, that add to your life. Because, when we're stressed and we're depressed, we think everything is down, 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 everything is bad, sky is falling. But we do have some things that do still bring us joy and that we should be grateful for. And by writing them down, it puts the thought into your hand and it puts it onto paper. And so you can review it. It just solidifies that positive thought. Exercise. We all know that being exercising can lead to better mental health and clarity. And then eating healthy, the same thing. If you're eating highly processed, heavily sugar foods, you can have that sugar dump. You can have a caffeine dump if you're drinking too much caffeine. So you want to try to make sure you're eating a nice, clean diet as much as possible. Get enough sleep every night. If you do have obstructive sleep apnea, make sure you're wearing your CPAP or BiPAP at night. If you haven't seen your sleep doctor in a long time, make an appointment, take your SIM card, not your SIM card, but your memory card with you, and have them download the data, see if there's anything they can do differently, if your mask isn't fitting well, or your interface, and then talk it out. Share your feelings with other people you trust. Also, maybe get a therapist, talk to your provider about seeing somebody, just to have a therapist to talk to. Attend groups like you're doing, watching this video. Pulmonary rehab, we have pulmonary rehab groups that meet online, meet in the gym based. That's a good place to interact with people. Better Breathers Club, church groups. Anything. We used to have a knitting group that would come to the hospital, and I would sit in with them. I didn't really knit, but just chat with them as they were knitting, and it was a great camaraderie they had, and they talked about everything, not just knitting. And then follow your treatment plan. Ed has mentioned before, and it is becoming more and more common to have like a COPD or chronic lung disease action plan. And, not just a sick action plan, you should also have like a well plan. So make sure you talk to your doctor when you're well, keep your appointments, because maybe if you're feeling well, you can escalate some things. You can increase some activity and maybe cut back on your home oxygen a little bit, try to test that out. So get a sick treatment plan and then a well treatment plan. And then practice newer thinking patterns. So meditation is a very good thing to have. Relaxation, other relaxation techniques. So pursed lip breathing, praying, just looking out the window into nature, looking out to the ocean here. You look out there, um, or go to your safe place in your mind if you're not able to get there. Those are all really beneficial things for your overall mental health, anxiety, stress, and depression. Symptoms of depression. It's going to be a couple of slides here, and just want to preface this by, you know, we mention the classic symptoms of depression that are mentioned in textbooks and articles, but it can all vary among individuals. So please, if you're feeling just out of sorts, and if something has you feeling depressed and it's not in this list, this is not a 100% complete list, make sure you talk to your provider, or some healthcare qualified healthcare provider that deals with mental health issues or depression or anxiety that can help you along the way to get better. So low mood most of the time, frequent irritability, not enjoying your usual activities, trouble sleeping or sleeping too much, a big change in appetite, often with weight gain or weight loss, and increased tiredness or lack of energy. Again, you'll notice that some of these are increased tiredness, and lack of energy, and then weight gain or weight loss, sleeping too little or sleeping too much. Everybody's different. Everybody's going to react differently, and everybody's symptoms can be different. Also, feelings of worthlessness, self-hate or guilt, trouble concentrating, feeling hopeless or helpless, and repeated thoughts of death or suicide. And depression is more than occasional sadness or frustration. And chronic lung disease changes your life. Feeling angry, sad, or depressed is understandable. So living with chronic lung disease can change your overall mood, but we have to learn to try to accept it, try to move on, and then get the tools to deal with anxiety and depression.
Right.
So when to call your doctor? You cry often or without cause, your depression has interfered with your work, school, or family life for more than 2 weeks, you have 3 or more symptoms of depression, and do not change or stop any medications without talking to your provider. And that just goes for about everything. And again, these are all flexible. These are all general rules. They're not absolute. So if you're only having symptoms of depression for 2.5 weeks, and it's a lot for you, call your provider. Don't wait till you just tick off, oh, made it 3 weeks, I'm going to call. No, that is not what we're trying to say. These are general guidelines. If you're feeling down and feeling out of sorts, please call your provider. Earlier is better. Also, if you or loved one think you should cut back on drinking, a lot of times when you're anxious or depressed, people start drinking more, and you feel guilty about the alcohol you drink, or you drink alcohol first thing in the morning, the red eye or the eye opener. People will drink in the morning, especially to just stop them from thinking and stop them from being depressed, but it makes things worse. And then we mentioned this on frequent slides and presentations. If your chronic lung disease symptoms get worse, despite following your treatment plan, call your doctor. So that's not specifically related to anxiety and depression, but both anxiety and depression can make your lung disease worse and your symptoms worse. So that affects it. They're all interchangeable. Mental health is part of health. So we have to get that really hardwired in our minds and in society. And then, of course, call 911, suicide hotline, or go to the nearest emergency room if you have thoughts of harming yourself or others. So key points to remember: people with chronic lung disease are at greater risk for depression, stress, and anxiety. Depression, stress, or anxiety can make chronic lung disease symptoms worse, make it harder to care for yourself. And your emotional health is just as important as your physical health. And learning how to deal with your stress and anxiety and getting help for your depression can help you manage your chronic lung disease and help you feel better in general.
Right. So what we want to do is turn that downward cycle into a positive cycle. It can be done. Once again, I want to make another pitch for the morlenhealth.com website, where you can find other videos with other information that can help you do that. And consider if you yourself have chronic lung disease or someone you care about, might benefit from a pulmonary rehabilitation program. Ours is one. It's available. It's home based, so it's available to you while you're at home. You don't have to go anywhere to participate and benefit from it. You may be able to get a referral, or you might have another program available to you. It's perhaps the single best way to turn that downward cycle into a positive one, and it can be very helpful to you or someone in your life with chronic lung disease. Thank you for allowing us to present this to you.
Thank you again for taking the time out of your busy days to watch our presentation. Really appreciate it, and we hope you get some benefit from it. Again, please go to morlenhealth.com for more information about our program and links to our other videos.
It's been a pleasure to present this to you.